Now we have about 15 minutes for a Q&A session with everyone who's spoken today. If you have a question, pop it in the chat. We'll try to get around to it if we have the time. Time is, of course, pressing in on us a wee bit here. But I'd just like to start off with a point for discussion, which is that the impression which I've got is that what's needed really is both legislative change and cultural change. And I don't think that one will succeed without the other. So how can we achieve these two things together? Changes in legislation, but also changes in the culture of mental health services. And I'd like to start off by hearing Aji's thoughts on that, if you're happy to talk about that.
Yes, yeah. Being optimistic, I think what I have really found, and Kevin, we're hoping to see the minister next week, because we find that we need robust implementation, and I am not quite sure if the civil servants quite get it. How much lived experience do they have? What angle are they working from? I just have, you know, uneasiness, because I don't want Seni's death to be wasted. We've been through so much. Let us just utilize the fact that it's happened. We want to make change. I don't know. I live in hope, but I do know that robustness may not be what the end result is for Seni's law. I'm just talking about that. I mean, because sometimes I think, what are they doing? You know, everybody has said we've had, you know, recommendation after recommendation, and it's just, you know, collecting dust. I don't know what is happening. There has to be, for me, there has to be a will to want to make things right from the top down. There is a will going up, but it's from the top down, and I'm just living in hope. But I don't know if Kevin would like to speak more on that, you know.
Yeah, absolutely, Aji. I think there are a couple of things. I think first of all is just looking at how the system supports the families. So yeah, it's a lot goes on the families themselves to have to advocate for themselves. And I think there is a thing about, well, we talk about in co-production, how like there should be roles that like are actually designed to support people to get involved and to share their expertise and to pay them for their expertise, because both Aji and Marcia do so much with the trust, and that's not always remunerated. And I think there's something else about joining up all the different frameworks. So we talk about Seni's law, Professor Kendall spoke about the PCRAF, and I've worked on Mental Health Act review as well. And a lot of the time the conversations overlap so much, but they're spoken about in different contexts. And I think there's just a case of like really realizing how interlinked they are. And maybe that's an argument to getting more resource behind it.
Yeah, I think you're so right. Yeah, little pockets going on and people don't even realize.
And the last thing I would say is engagement as well. That was something that I found personally useful in the Mental Health Act review. Just like, yeah, a lot of well, racialized communities are like deemed hard to reach and whatever. And actually, when you do manage to engage with them, and it's really not too difficult to do that once there's a proper effort behind it. Once you are able to engage, like the opportunities just seem endless, and there's just so much value in it. And I think there are changes on both sides. You just like learn to trust one another a bit more, and there's so much that can come out of it.
Could I just quickly say, yeah, I agree with what Aji and Kevin has just said. I would just add to that you know what, Dr. Shadi Darani, sorry, don't know if I'm pronouncing it correctly, yeah. You are absolutely spot on. We've been here before, we've had these discussions, the death of Rocky Bennett, and so on and so forth, yada, yada, yada. Book. Tick boxes, you know, I'm tired. We're tired. You know, I don't know what more to say, just get on with it. You know, because people are dying. You know, we've had these conversations before and I've met them. I mean, I'm relatively new to this. It's 13 years. I'm relatively new. And, you know, I'm astounded that nobody knows what to do. In the meantime, we're wasting money because everybody's getting paid, including all yourselves. We don't. You know, it costs us a lot to our well-being, but it's because of our passion of it, because it's affected us. And, you know, we're the ones that are making the changes. But you can help by like sharing this video to a wider public, you know, be more seen, that you'll be more open and robust publicly and not just on paper for yourselves. It's of no use to us. At the end of, I'm not ridiculing the work that you're doing. I'm not. But you know, if you wanted to make effective change now in the digital ages, you know, is to just be open and frank. And all we need is accountability. So let's give an example. It can be done. Okay, it wasn't mental health, but it was still an injustice. In Sarah Everard, robust. None of the evidence was covered up. You know, that somebody's gone to prison for life. Yeah, this was a white woman. There's white privilege. And I'm not saying that shouldn't have happened, but it just proves that they all know what to do. Just get the hell on with it. That's, I'm trying to be polite. But we're all grown-ups here.
That's
it's bullshit, basically.
I think you're raising a really important point, Marcia, which is that it's the question of how, you know, we move from statements and from things on print to actual change. And I wonder if there is perhaps some degree of resistance within the culture of mental health services, what the nature of that resistance is and how it can be overcome. And I'd be interested, Sashi, in your thoughts on this.
You tell me.
Yeah.
Oh, thank you very much. I'm absolutely convinced that our mental health services are not going to bring about the change we want. It's not just that they are not committed to it. They just don't have the capability to understand, implement changes. They do not. They're not programmed to do that. Whatever Tim Kendall says here today at the meeting, his ability to shift the dial here is, I would say, zero. So we go back to doing the same old things that we have done for 40 years. Further reviews, further measurements, more frameworks, and people continue to die. People continue to be restrained. If anything, the latest statistics show that the proportion of Black people being detained in mental health services has gone up in the last 2 years. It's a general problem across the country that the detention rates are going up, but more so for people from our communities. And no mental health trust in this country, as far as I know, is seriously committed to reducing that through practical measures, making people accountable for their decisions. Being asked the question, simple question, why are you restraining somebody? Or registering this, identifying it as a serious untoward incident that causes harm potentially, that compromises patient safety. Every time that happens, it has become routine. It has become integrated in the culture of psychiatry. No consultant psychiatrist I know wonders why he or she is having to force people. We have become inured to that. And that is going to change. And that won't change through law. We had an opportunity through the review of the Act. We ended up with a damn squib at the end of it. None of those recommendations is going to make the slightest bit of change to the experience of BME communities. And I would also point out that our practitioners on the ground, the nurses who do the holding down of black bodies and injecting them, are mainly black now. And they are seriously traumatized by what they have to do. We did a series of focus groups and it came up very clearly. They're absolutely terrified, traumatized, and helpless. And they want to be together with the patient that they're harming, but they're not able to do that. They realize nothing happens. They realize it's routinized. So the only way it's going to change is through people like Marcia, through people like Ajibola, and people on the ground taking action. And that's what we are doing. We are fed up waiting for people to do things for us. We are getting there. We are getting the community into those spaces. We are challenging those clinical decisions. And until we challenge the clinical decisions, how a psychiatrist makes the decision or a nurse makes the decision to actually hold somebody down and inject them, we got to challenge that at that level. And that's where we got to be at. And our project, we hope, will be a start, a small start. And that's why I'm very keen to involve everybody in that, to come and see what we are doing, be part of that, and continue to generate momentum, anger, and resistance through meetings like this, through the experiences, harrowing experiences that we have heard.
This is a challenge really to some very fundamental basic assumptions and frameworks which people take into practice. And I'd be very interested to know from Kevin how this relates to the findings of your research.
So what specifically is the question?
Yeah, and the question is that what's actually said is that, you know, it's the case that consultants and other people on wards might not question the assumptions behind their actions.
Yeah.
And I wonder if this has been reflected in your research, and if this is indeed the case, how you go about really challenging these very sort of fundamental things which people are bringing to practice and which are potentially extremely harmful.
Yep. So two things come to mind. First of all is our training. So I'm aspiring to be a clinical psychologist. We have clinical psychologists and psychiatrists in the room. And very little of our training would make me immediately think of, say, Adji and Marcia and what they've gone through and what their families have gone through. There's just a bit of a disconnect there in what's traditionally taught. And we, I suppose, have to think differently about how we cover those issues. I mentioned the course we're doing called Seni's Story that will have Adji teaching on it amongst other people. And I would love for that kind of stuff to be like when I try to get onto clinical training, I want that to be as part of our course. Another thing that comes to mind is a bit different, but it's the sort of professional roles. And I mentioned police clinician interactions, and when police come onto the ward, and actually what some mental health staff were saying was that they almost feel responsibility to defer to the police because they've called the police, and almost like it can be hard to challenge the police in that scenario. The police are quite used to taking control over a situation when they're called on it. And I think there's just a real need for an open discussion on that kind of culture of when police are on mental health wards, that the mental health staff are still taking the primary responsibility over that. So I think there are just a lot of areas that aren't really spoken about on clinical training that really need to be spoken about. And the way to open up that conversation is through having people like Adji and Marcia and people from the community teaching on our courses.
I mean, I get the message from that what's really needed is to get in early in the training and, you know, to have the value of the terrible experiences which Aji and Marcia have described, to convey those to trainees, and to really start off by addressing these assumptions and these frameworks, you know, at the very beginning of people's careers in mental health services, to really get that necessary cultural change. Now, I have noticed that the time is now 2 o'clock, so time is up on the webinar and the time we have allotted. So I'd just like to end by thanking all of our speakers, thanking VBP and Ren, and thanking Colin, also thanking Sade for her chairing of the discussion between Aji and Marcia. And I'm going to now hand back to Aji and Marcia to give the concluding remarks. Thank you.
Just really like to thank Colin for, I think Colin only calls me because I live near his favorite football ground. So he calls me because I live near Crystal Palace to find out. I'm cussing them because they're parking in our road. But Colin, thank you, really thank you for giving Marcia and I and Kevin the opportunity to share such a august platform. You know, it's really, you know, they say you learn every day. You really do. I've learned so much. And, you know, I just want to really remind everybody about our march. But Marcia is very good at that. So I'm going to leave Marcia to remind everybody about the United Family and Friends and our campaigns. And if you Google our names, you'll see about the campaigns, or Google loved ones. And the other site that is very good is Inquest, the charity. We work very closely with them, and they supported us with our lawyer, Raji Bhatt, who's brilliant. And, you know, Marcia does a lot of work with them. We both do a lot of work with them and the Family Reference Group. So Marcia, over to you. And thank you, everybody for having us and for listening and for responding. I'm not very tech minded, but I can see the chat, you know, and thank you.
Yes, absolutely. Thank you, Aji, and thank you all for having us. So I will wrap up to tell you all a little bit more about the United Families and Friends campaign, which is a coalition of families across this country, not just Black families, everybody whose loved ones have died at the hands of the state, be it in police custody, in prisons, and or mental health units, or
Hillsborough.
Pardon?
Hillsborough.
Yeah,
and
the Hillsborough campaign,
Grenville.
you know, the Bloody Sunday campaigns. You know, we consist of a large amount of families that over the years that we've united with and speak with, including internationally. And once a year we remember our loved ones, and it's the last Saturday of October of every year. It's in its, I think this is the 23rd year. It was set up by the families of Joy Gardner, who was choked to the, tape was put around her face, you know, in the 90s, and the Brian Douglas, where he was hit over the head with a truncheon, and the families of Roger Sylvester, also Black mental health and police restraint. They set up UFFC, which is really important that we remember our loved ones. So this Saturday, Trafalgar Square, 12 noon, where you can meet families, and we walk down Whitehall and we speak outside number 10 Downing Street, and we usually hand over a letter where we write to the government. And they've never afforded the families a meeting in the 20 odd years, and then they don't correspond fully. They have the last few years, but those letters are public. You can go on our website and read the letters that we have written. Also, we will be putting the state on trial. If you Google People's Tribunal, where we are working with Black Lives Matter and Ken Farrow, the film director who's done the film Injustice, and an update is to the film Ultraviolence, where you hear directly from the families, and to show the trauma that we receive indefinitely. So you can look on the website, the People's Tribunal, and the Mikey Powell National Memorial Fund. We all work together. We need funding. Families do not get automatic funding and legal aid for representation. We don't get funeral costs. We don't get bereavement counselling. We don't get nothing. We only get injustice. We need justice and accountability. We need practical support. If you go on those websites, you can see how you can practically support us. Share the information on Twitter, on Instagram and TikTok. We need to get to the younger generation. We, as much people as possible that can be there. You know, this includes the death of Sever Everard right down to the last 50 years of injustices, and we remember our loved ones and they will never be forgotten. Support us in that way. I would love if Michael Bennett could be there to support the families and speak on behalf of the Daly and Atkinson family. I think that's a really important case. And if not, I will introduce the public to you, Michael, if you're unable to make it. But I'm looking forward to speaking with you and all the other panelists again in this room. Thank you very much for your.
Thank you. Thank you. Thank you. Thank you. Thank you.